now I'm going to demo the extraction technique. To begin, I want to take my gloves, and I like to apply my gloves below the table on the side of my client to avoid the uncomfortable sound that the gloves make. Then I'm going to cover up my client's eyes, and I have chosen to use damp cotton rounds to keep the eyes nice and dark and protected, and it allows me to do extractions around the nose area. After I have applied my client's eye protection, I'm then going to apply my glasses. I have next to me as well, I have extra aesthetic wipes. I have prepped my aesthetic wipes or soft gauze for my extractions. I have just made them into triangles. I have my extraction tool, my round lens set, and a sanitizing solution for post-extractions, which I will put over here. Once I have started and have everything set, I'm going to turn on my light, sanitize my hands, and ready to put on my soft gauze. I'm going to take my triangles and put it over my pointer finger, like so. Hold the edges and slightly pull back and hold that with my thumb, and then twist. I will create almost like little bunny ears and repeat that on the other side. Once I have prepped my finger gauze, I'm then going to do my extractions. I'm going to begin my manual extractions, and as a professional, it's great to have other methods of extractions using manual extractions, your lancet, as well as an extraction tool. First, I'm going to start with the nose. I'm going to take whatever side my hand is on the client's side of the face. I'm going to take that same hand, brace with my thumb, pull down at the edge of the nose to create a little bit more of a flat line in the edge of the nose. I'm going to come in parallel with my other hand, and I'm going to pop up that edge of the nose. And we can see it popped up, and then I'll start wiggling to release those impactions. I want to make sure that I am always keeping my fingers parallel, never pinching the skin. That is one way to traumatize the client's skin, as well as cause more pain. And then I can wipe. And for the other side, I'm going to take my opposite hand with the same side of my client's face, brace with my thumb, pull down at the edge of the nose, and come in parallel and rock back and forth. Making these rocking back and forth movements like so help to release that impaction and bring it to the surface. Does that feel okay? Checking in with my client that she's not in too much discomfort. And I can do the same thing on the top of the nose. I'm going to pull taut, spread my fingers apart, and then come together and wiggle. I can also, if wiggling is not available or able to do on the bridge of the nose, I can do a little rock back and forth, a more gentle movement. I'm going to do that same movement on other parts of the skin. Coming in, pulling taut, and parallel wiggle. And wiggle. And then wipe the debris away. Stretching taut, coming in, and wiggle. You'll notice that I am bracing my fingertips with my thumb on the other part of the face to ensure that I do not slip. Wipe away, and then I can move to any other area on the skin, doing the same movements, pulling taut, coming in, and wiggling. If you do need to use a lancet, you can. This is going to help the impaction come out easier. And now I'm going to show you a few other techniques to help with extractions. I have found a lesion on my client's skin, I'm going to stretch the skin taut to allow me to see the follicle opening with my diopters. I'm going to come in right at the follicle opening and make a small hole. And then I'm going to take my extraction tool and place it directly around my client's lesion. Gently press, and I can also use that rocking motion. I never want to slide across the skin, and I want to make sure that my pressure is not too hard. It will leave a little bit of a mark, but making sure that it is not too deep. And there we go. And if I am needing to use a little bit more of a precise movement, I can take the flat side of my extraction tool, stretch the skin taut, and just press around that follicle to release it. And there we go. And then wipe off. When I have finished with my extractions, I'm going to cap my lancet. On the flat part of the cap, I'm just going to insert that needle and then place it into the sharps container. And now I'm going to disinfect my client's skin where I have extracted so that we do not spread the Propionibacterium acnes to surrounding follicles. I have my post-extraction type solution, and I'm just going to swipe it over those areas that I have extracted. Once I have finished that, I'm going to throw this away, as well as my client's iPads. I like to just wrap them up into my gloves and throw away my gloves.